Hello people, today we are going to discuss about the midgut rotation. Let's proceed. Now we know कि we have three guts, foregut, midgut and hindgut. The foregut being supplied by celiac artery, the midgut supplied by superior mesenteric artery, and the hindgut being supplied by inferior mesenteric artery. Now we are talking about midgut. We know there is a physiological hernia which takes place during the development week, mainly 7th to 11th week of development. And what does it results in? The midgut loop, it herniates through the uh, umbilicus, and it lies outside the abdominal cavity in the extra embryonic coelom, right? So today we are going to discuss about the midgut rotation. Now let's focus. We know that midgut is the one which is being supplied by the superior mesenteric artery. And remember, during the development, the superior mesenteric artery is the one which divides the midgut into a pre-arterial or a cranial segment and a post-arterial or a caudal segment. Now remember कि we have the superior mesenteric artery coming out of the umbilicus. We have pre-arterial segment of the midgut loop, which is this one. This one is a pre-arterial segment, and we have a post-arterial segment, that is this one. And here we are representing, this pen is going to represent the superior mesenteric artery. So we can imagine we have a person which is in front of us, and means embryo which is in front of us and which is going to show us ki this is going to be its superior mesenteric artery, it's going to be its pre-arterial segment, a part of midgut loop, and this is going to be a post-arterial segment, that is a blue pen representing a post-arterial segment, a pink pen representing superior mesenteric artery. Now you need to know, before understanding midgut loop of rotation, you need to understand there's a total rotation of 270 degrees, and that is counterclockwise direction, right? Remember, it is a 270-degree rotations of the entire midgut which takes place, and it is 270 degrees. Secondly, the axis for the midgut loop rotation is provided by this superior mesenteric artery, Now what happens? First of all, this entire thing is not like this, right? First of all, we have the three segments. You can clearly, it can be represented with my this three fingers. Remember, my middle finger is going to represent the superior mesenteric artery, the my index finger representing a pre-arterial segment, and my inferior finger representing, that's a ring finger, representing a post-arterial segment. So initially it's like this. Initially it is oriented in a vertical direction. Now what happens, I'm showing you the second step, in which remember, this side is going to be your right side, right? This is right side. So what happens, initially we have a 90-degree counterclockwise direction which permits the pre-arterial segment to lie in the right direction, and the post-arterial segment comes to lie in the left direction. So I have now completed the 90-degree counterclockwise direction, and it is occurs outside the abdominal cavity. Now we can proceed to the next step. So in this next step, you can clearly see the 90-degree counterclockwise direction has already been completed. The superior mesenteric artery, which is lying in the midline, the pre-arterial segment comes to lie towards the right side. So remember, this is going to be your right side, right? And this side is going to be your left side. Now we know, and this is going to be your anterior direction, and this direction is going to be your posterior direction. Now remember what happens, we have the 90-degree counterclockwise rotation being completed. Now we have the pre-arterial segment, which will develop into second part of duodenum, beyond the major papilla, the jejunum and ileum loops, right? Now this is going to lengthen out. The first of all, the pre-arterial segment is going to lengthen out, and it's going to form the coils of jejunum and ileum. Now when the coils of jejunum and ileum being completed, it's going to be a very bulky structure, right? And remember, we have now in midgut loop of rotation, we have a 90-degree counterclockwise rotation, and this rotation will also permit the pre-arterial and the post-arterial segment to retract back into the abdominal cavity, but it won't occur simultaneously. First we have the pre-arterial segment, which is going to go towards the back, into the abdominal cavity, and second we have a post-arterial segment which will move back into the abdominal cavity. Now the pre-arterial segment, since it is the first part to go to back to the abdominal cavity, so it would, the parts which are derived from the pre-arterial segment are going to lie towards the posterior of the abdominal cavity, right? Now this is how you can understand ki why the jejunum and ileum lie towards the posterior aspect of the abdominal cavity. Similarly, we have the pre-arterial segment, we have the post-arterial segment, and this post-arterial segment is last to retract back into the abdominal cavity, and therefore the derivatives of the post-arterial segment, that's going to be your transverse colon, going to lie anteriorly of this superior mesenteric artery, right? So what happens usually ki this pre-arterial segment is going to lengthen up, and what happens, we have a 180-degree counterclockwise direction rotation. But what happens, first of all, this, yes, this pre-arterial segment is going to undergo a 90-degree counterclockwise rotation, and it will retract back simultaneously within the abdominal cavity. Since it undergoes a 90-degree counterclockwise rotation, therefore it will loop around the axis of the superior mesenteric artery, and it will come to lie towards some part of it would come to lie uh, some part of it would come to lie towards the left of the superior mesenteric artery, that's your jejunum and ileum. And remember, we have the most posterior most structure, that's going to be your duodenum. So this line would be representing the duodenum, and duodenum would be lying posterior to the, comes to lie posteriorly along the superior mesenteric artery, right? So this is the thing which occurs. Now we have a post arterial segment which is going to retract back into the abdominal cavity. When it retracts back, this pre-arterial segment is already being back, and it occupies the abdominal cavity, the jejunum and ileum part. Similarly, we have a post-arterial segment, the counterclockwise rotation, and whenever this post-arterial segment undergo a counterclockwise rotation, it will undergo the rest of the 90-degree of the rotation, such that whenever it undergo a rest 90-degree of the rotation, it comes to lie anteriorly, because since superior mesenteric artery is also being connected, it will also retract back, and this post arterial segment comes to lie anteriorly of the anterior part of the abdominal cavity, and that this is how the transverse colon lies anteriorly. Now remember, we have this transverse colon lying anteriorly. Now remember, this part, the cap of this pen, is representing the cecum. So normally the cecum lies in the right iliac fossa, but the cecum here lies in the subhepatic position, and the transverse colon lies anteriorly. Now what happens, whenever the cecum undergoes whenever this cecum uh, develops further, it results in the uh, position change, or position change from subhepatic to lumbar, and from lumbar to right iliac fossa, right? And similarly, it stretches this loop of the transverse colon, so that this transverse colon forms ascending, as well as the two-third part of the transverse colon, and rest part of the colon would be contributed by the hind gut, right? So this is the entire mechanism which is going to occur in the cases of development of the midgut rotation. Thank you.